recently ke bile le a chat le Lebo about pregnancy, right? It's very technical from what I came to learn. In that, there are a lot of things to consider to make sure the woman conceives in the safest way as possible, such that she's not affected, Lingwana is not affected, right? So, I had a few questions pertaining to why are we the only mammals, right, that lie on their backs to conceive the babies when we should actually be either standing on our fours, because most animals are standing on their fours when they're giving birth, right? So here's what she had to say. But before that, let's cut to one of the 21 ladies sharing her experience. Go conceive one, right? Listen, tune in, you might learn something here. Very interesting topic, actually. Peace.
Hi, Coach. So with me, I had two natural births and with epidural. So unfortunately, when you have epidural, your mobility becomes limited. You can't move because it numbs you from the waist downwards. So you just literally sit on the bed. Your legs become heavy. You have to be on a catheter. So basically, you can't do anything. So, and when it's time to go deliver, unfortunately, you lie on your bed, on your back. They had to tie my legs because again, I can't feel them. They were numb. So got my first child. Yeah, they had to tie my legs. And worst part, got my first child. I didn't know what is it to push, so they had to explain it to me to like say, hey, it is picture ogare yetsa number two. That's what we call pushing. So with my son, 11 years later, so they removed the epidural. So when I was going into labor, so my feelings were coming back, Mara. I still couldn't feel the pain. So the edge, I could feel it. So they had to make me lie sort of on the bed. And yeah, and I could just feel there's just this edge so yeah, so that's how it happened. And that boy was just coming, and yeah, he came. So unfortunately, I didn't go through that pain ya hore wa tsamaya or o nyaka water birth. I just went for epidural, and yeah, in a normal hospital. So in a nutshell, that's my birth.
And,
Hmm.
pertaining to the way Western medicine approach young pregnancy ka thing. Well, the process of conception, right?
Okay.
Why do we are the only animal or mammal that lies on their back when giving birth, as per context, yeah, Western medicine. Why?
Hmm. It's actually not always this way, right?
Mm,
There is a position called all fours where the woman will be on her knees and on her hands to deliver the baby.
mm,
Um, I guess in our hospitals, because of our beds and in terms of how easy as a doctor I'm able to maneuver and help baby to come out as mommy is pushing, right? But a patient does not necessarily have to give birth lying on her back. Now, of course, bring it up to your midwife in a clinic or in a hospital might be a very sour point because we like convenience, we like rigidity, we like routine. You
mm,
lie on your back, we pull the baby out, but it doesn't have to be that way. Um, it just so happens that it's how it's done and it's how it's being done, but it doesn't have to be that way. Women can give birth in a squatting position if that's more comfortable for her. But obviously, then, if I am her doctor or the sister or her midwife, you worry then, or if anything happens and she's in the squatting position, am I going to be able to act swiftly enough to get the baby if I need to?
mm, mm.
Mm.
Oh, obviously, the space where the child is given birth in, Tlamele, I mean, that's just the like a innovation problem, innovate a
Mm.
space that allows for the different cases. Because I think a lot of the time, lying on the back, one doesn't allow for gravity to also play its role.
Mm-hmm.
Most animals give birth standing. Haukashibisi, they give birth
Mm-hmm.
standing.
Mm-hmm.
There's a gravity factor that comes in there, and it makes the birth process a lot faster. I was having a chat with a
Right.
friend of mine. His woman, they gave birth katlung, they didn't go to the
Mm-hmm.
hospital. So he was telling me hore in the process, like his wife now,
Mm-hmm.
she basically sort of like in giving birth, Bamqadile, obviously she was lying down. Then
Mm-hmm.
a batla ho emella yena. It's like she now the midwife, and they allow her to basically navigate in a particular way. But the midwife
Yes.
now wants her to lie down. But yeah, now she wants to stand up because she feels
Mm-hmm.
like ego one or one.
Mm-hmm.
And this is the right position for me to push the baby out, you know?
Mm-hmm.
So I feel like having like a flexible system where you really like support the mother in that sense, as opposed to let's make her
Mm-hmm.
morbid, apatlame, and she must push from hupatlame. That also now obviously has an effect on her system because she's applying too much pressure there, right? And then obviously,
She's
like you're
doing
saying,
something she's not comfortable with.
mm-hmm,
For women who can afford, they can get. There are midwives, privately though,
mm,
um, and doulas who do home births, specifically looking at a medication-free birth, but also an unassisted birth. So they let the mom do what her body tells her to do. But things
mm,
in our setting, it's almost impossible to give every mom the choice to do that. Or this is that where now you are saying, okay, choose the position you want to be in.
mm,
Because now I've got 30 moms who are in a full labor ward. And now wants to squat, wants to be on all fours. It's not feasible in our departments. Obviously, we don't have not the space, not even the manpower for that. Ne? So with her lying on her back, it's easier to control what is happening as you receive baby from the pelvis. Obviously,
mm,
if baby's breech, you can act quickly. If baby's coming up where the face is in a bit of an abnormal position, it's quicker for you to act. Ne? So
yeah,
if you have a person who's there for you one on one, they can then allow more flexibility um, in terms of how you want to deliver. And then they also trained to do that at home. And look, if there are any complications, they can then step in and help to resuscitate the baby if need be.